welcome to Pelvis Party. My name is Becky Mopetit. I am the owner of Rochester Local, and if you've been around for a little while for Pelvis Party, you know that this is Britt Marshall. She is with Marketing Communications at Olmsted Medical Center, but today we're joined by Gretchen Young. Hi, Gretchen.
Hi.
Gretchen Young is a physical therapist at Olmsted Medical Center.
Hold that thought.
Yeah?
Physical therapist.
Yes.
That is a super general term, and I've actually been really confused by it because physical therapists don't necessarily do what you do, and we're going to get into what you do, but maybe you could tell us what you specialize in.
So I specialize in a couple different things, but one of them is pelvic floor rehab.
Mm-hmm.
So pelvic floor rehab is focusing on the muscles of the pelvic floor, issues of the pelvis, pelvic pain, incontinence, SI joint dysfunction.
So when you go to school to become a physical therapist, are there, you study physical therapy and then you decide, oh yes, this is going to be my specialty, and then you do further schooling, or do you just follow a track, or how does that work?
So it's continuing education.
Okay.
So you follow different continuing education companies to get your certification and do, extra work.
Mm-hmm. So how long have you been a physical therapist specializing in what we're going to talk about today?
So my third year out of school, I was working in Owatonna and worked with another therapist, and we started a pelvic program there.
Wow.
And then when I came to Olmsted, somebody else was doing it, so I waited about 3-5 years and then was offered it. And it really took off when Dr. Richards came because she championed us.
Yeah, absolutely. Yes. So how long have you been focusing in that area at Olmsted?
Well, I've been a therapist for 33 years, so 30 years on and off.
Probably not much that you haven't seen, right? So I can't wait to talk about this, right?
You know what else is super exciting? That Gretchen and her colleagues get to practice at the expanded space on Elton Hills Drive.
Oh.
Going to over 10,000 square feet, more rooms to do your specialty therapy.
Yes.
As well as a small gym.
Yes.
A waiting area.
Yes.
It's a nice, private, quiet room.
Yep.
So much nicer.
That's right on Elton Hills and Broadway, across from the rec center. Been watching that construction for a while, and it's so thrilling that it's finally open, and I'm sure the patients really appreciate it too.
They do. They really love it.
Oh, fun. Okay, so what is pelvic floor therapy? I mean, a big question, but a little question. What is it?
It's just targeting what we call pelvic floor dysfunction. So it's finding out why the muscles aren't working like they should, that are bringing on the patient's symptoms.
Okay. So what would be, I know I'm sure it's a really long list, but what's a few things that would bring someone in to have pelvic floor therapy?
So pelvic pain. And that can be pelvic pain either after delivery, because maybe of suturing that had to happen from a tear. It can be because of trauma in the area.
Okay.
It can have been going on for a long time or short. So pelvic pain.
Is that like the muscles from like your belly button down, or like a certain area?
So the pelvic floor is, think about if you put your hand on your crotch, that's pretty much where the pelvic floor muscles are.
Okay.
So they're at the bottom of the pelvis. They support your bladder.
Okay. Yeah. And a lot of other organs that are in the area. So, I mean, maybe a relatively small area in kind of our understanding.
Sure.
But crucial. Crucial to so much.
It is your deepest core.
Is it?
So when people talk about strengthening the core, they think of their lower abdominal, but the deepest core is your pelvic floor.
Is that not fascinating? I did not know that. And so everybody always talks about strengthening your core, and everybody's doing this work right here. But it's all the way down to your pelvic floor.
Right.
That's really interesting. So what are some common treatments that you are going to do for someone who has come in to see you? Or maybe we can ask, what is the most common thing that you might treat as a pelvic floor physical therapist?
It used to be urinary incontinence.
Okay.
So now it's just a mixture of urinary incontinence, so leakage of urine when you don't want to. Or urinary urgency, which means I can't get to the toilet fast enough.
Right.
Or I'm going every 20 minutes or every hour when you should be going every 3 hours.
Okay.
Getting up at night multiple times. So that's urgency.
And
then again, the pelvic pain.
And pelvic pain. Okay, so when someone comes to see you, have they been to a doctor? Have they been, had a referral, or will they
Most,
sometimes
yeah,
just make an appointment with you?
they can make an appointment without a doctor's referral. It depends on their insurance.
Okay.
So most insurances will like a referral from a physician.
And
So
OMC, you can do what we call self-refer.
you can self-refer.
Oh, how does that work?
Through your OMC MyChart portal, you can go on and schedule an appointment, or you can call the rehab services.
That's a really nice feature that I love MyChart.
And if patients are unsure what it's going to entail, maybe it's something that they heard about on the radio, or maybe Pelvic
On the
Party.
podcast. Yes, exactly.
Or their doctor recommended it, and they're not quite sure what it involves. We are more than willing to field phone calls and just talk with them about, what are your symptoms? Here's what you can expect when you come in, just to calm their fears of what am I getting myself into.
Okay, so I'm interested to learn more about like this pelvic urgency. What is it? Urinary urgency and urinary incontinence. So can it happen at any age?
Yes.
It can.
Yes.
Okay. So what is the most common age that you see?
I would say probably childbearing years.
Okay.
You see it come on, but it can happen in adolescence as well. So the thing about urinary urgency, well, let me use my props.
Yes, I want to see your props. Look at all these great props that she's brought. I cannot wait. Okay.
So think about your bladder. This is a pretty big balloon, but
yeah, I was going to say, wow.
Think about your bladder. So urinary urgency can happen if whatever is inside the bladder is irritating it.
Okay.
So too much coffee or caffeinated beverages, or not enough water.
Gotcha.
Okay.
Yep.
So when a person comes in, we'll ask, what have you been drinking? How much have you been drinking of that? And looking at what the contents of the bladder, what's irritating it. So one simple thing that I recommend, I love my coffee. I don't like to give it up.
Yeah.
So when you're drinking your coffee, drink a couple sips of coffee, couple sips of water. Dilute your urine.
Okay.
Okay?
That's hard.
Yeah.
Yeah.
But
I love a cup of coffee, right? I love coffee in the morning. So really
drink water at the same time frame.
As soon as you fill up your coffee, you need to be filling up your water bottle. Okay. All right. Yep. All right. So I think you have another prop, and I'm really wanting to see what this is.
So
I want to know one other thing, though.
Yes.
It's like the hot word Kegel.
Yes.
Like Kegels aren't going to solve what we just talked about, probably. Trying to do them on your own. And that's why it's so critical for people to come in and see a physical therapist and talk through what the specific symptoms are and get treatment for it, right?
Right. So not all the time, but I would say the majority of the time, if you have urinary urgency, you're probably going to have high activity of your pelvic floor. They used to call it high tone. They're starting to call it high activity. So you're right. If you do a lot of Kegels, they're not going to, solve your urinary urgency. You need to actually get your pelvic floor resting tone down to normal range. So
that's where this comes
in. This is
in.
a vaginal probe. It's like a tampon. It's got some sensors, so it reads your pelvic floor activity.
Okay.
So sometimes if somebody does not want me to insert it, it's fine. I'll show them how to do it. They can do it privately. And then we will interface it with a little biofeedback unit that shows a numeric display, or we can put it on our computer to show more of a picture kind of display, bar graph,
First part of the exam then, or?
So, it's part of the exam. We do a physical too, but sometimes people defer that. The physical exam is not like an OB. There's no speculum involved. It's a single finger digit palpation just inside the vaginal area just to palpate the pelvic floor muscles.
Okay.
But if they defer that, even if we do it, sometimes we'll do this too if I think they have a high activity level.
Oh, sure.
The pelvic floor resting tone should be about 2 to 3 microvolts when it's chill, when you're not using it.
Okay.
Typically,
right now we should just be
it should be chill. If you have urgency, it can be 10 to 15 microvolts.
Microvolts?
Microvolts. That's what it's measured.
Oh, wow. Okay. Okay.
Yeah. And so we do techniques. So there are a couple different things. Diaphragmatic breathing, there might be another trigger that's getting that pelvic floor ramped up. It can be muscles around the pelvis. So inner thigh muscles play a huge role. For instance, somebody who has a job where they're on a ladder for a long period of time can get really tight in their inner thigh. And if the inner thigh is really tight, it's going to start pulling on the pelvic floor. And it's going to excite the pelvic floor muscles, getting them to over-recruit. Glute muscles, low back pain, SI joint pain, they can all ramp up the activity of the pelvic floor.
And so what you're really trying to do as in physical therapy is bring that microvault down, back
Quiet
down
it.
to two or three. So
Correct.
somebody their baseline may have been escalated. And so now their baseline is here. Oh, interesting.
Yep. So we're trying to bring it down. And then usually the urgency is reduced. A lot of times people with pelvic pain will have a high activity level of their pelvic floor as well.
Okay.
So if we can bring that down, their pain comes down.
Oh, that's fascinating.
Yeah.
So if you have, let's say, pelvic pain during sex, I have a friend who's talked to me about this and really uncomfortable, and that's a reason to come see you too.
Definitely.
Right? And can self-refer.
Can self-refer.
We don't want to talk to a lot of people about it.
Exactly.
Maybe need to start some type of physical therapy.
And it can be as simple as getting that pelvic floor to quiet down. Not only diaphragmatic breathing, but we call it ischemic pressure hold. So just say you had a tight muscle here and I push on it for a while and I let go and you're like, oh, that feels good.
Yeah.
You can do the same thing. Find the muscle that's tight in the pelvic floor. Put pressure on it for a while. You usually do 90 seconds. Release. Let that muscle quiet down.
Fascinating.
Now, the flip side is just say your resting tone is normal, but you're weak. And so I asked you to do a contraction,
a Kegel,
with this in place, and you can only budget a few microvolts.
Oh, interesting. Yeah. So then you need to work on that.
Then we would work on the strengthening. So the strengthening that we do would try to get the brain to isolate the muscles, make sure you're doing your Kegel exercise correctly. But there's also muscle or exercises we can do that use a muscle that connects to the pelvic floor.
Oh.
And we get that muscle working, and because it connects to the pelvic floor, it will strengthen the pelvic floor. So,
Gretchen, you are a wealth of information. I love talking to you about pelvic floor because you can just see how passionate you are. And clearly we want women to be living the best version of their lives.
Exactly.
Right? And things like pelvic or urinary incontinence and urinary frequency or voiding issues is not contributing to a high quality of life.
Right.
So I can see how it's fulfilling to you as a provider to help
and in
your
later
patients.
Years, it's one of the main causes that women are admitted to nursing home is for urinary incontinence. So if we can keep that pelvic floor strong.
Yes. That is a good reason to be working on your pelvic floor, my friends.
Yes.
Well, Gretchen, we want to thank you so much for joining us on the Pelvis Party. This has been so fascinating with you and your bladder. So thank you so much for joining us for Pelvis Party, and we will see you next time.